Hi everyone, welcome back to the Dr. Sia channel. In this video here today, I'm responding to another request by one of the viewers here on the Dr. Sia channel who's requested me to talk about things like addiction, self-injury, eating, and whether ISTDP is actually an effective treatment when people are using drugs of any form or any kind to actually disconnect from their own emotions. So let's get started. All right, so it's specifically one of the viewers of the channel asks, is it possible to do ISTDP when a person is using drugs to not feel anything? Well, yes, it absolutely is. And one of the things that we do then is, rather than kind of be pushing down into the emotions, rather than kind of consistently and persistently be asking the person, how do you feel, how do you feel, how do you feel? One of the key aspects of ISTDP is helping people identify and overcome their defense mechanisms. That's absolutely one of the key aspects of most therapies, to be honest, even if they don't call it defense mechanisms. Behavior therapy, for example, that does a lot of exposure. I mean, in other words, exposure is to say to a person, look, you're having avoidant tendencies. If you just confront your fears, then your fears will reduce. So that's another way of saying, remove your defense mechanisms. So across most of psychology, one of the most effective things to do is to help people recognize their defense mechanisms and how to reduce those defense mechanisms or abolish them altogether so that they can then actually get in touch with the feelings that they have. Now, in terms of addiction, self-injury, and eating, we could be looking at all three of those as riddled with defense mechanisms. But what you want your patient to do is to be able to recognize that they are, in fact, for example, let's just stick with addiction, using the drugs, say alcohol, as a way of disconnecting from their feelings. And to help them see that that's actually harmful to them. And also help them regulate the anxiety that happens as they reduce those defense mechanisms and more complex feelings stir up, which then in turn results in anxiety for your patient. So what you really want is to have a clarifying, elucidating, enlightening, insightful conversation with your patient about their particular use of, for example, alcohol. For most patients, once they understand what the drugs are about, why they are there, what the purpose of the drug is, at the very least, what I found that they'll do is that they'll at least go over to less harmful medication that can achieve the same thing. So my patient might say, well, look, I'm not ready to let go of trying to undo my emotions yet, but I understand that alcohol is not the best way to do that. Well, I could possibly go to, get some antidepressants to do that. Now, that's not a huge win, but it's somewhat of a win for a person who's, staring at the face of death, perhaps, or chronic brain injuries or traumatic brain injuries and so on and so forth through the consistent and persistent use of alcohol. So it is very much possible and likely that you can help one of your patients if they are using substances to reduce their feelings using ISTDP as a modality. But what you would have to do is to help them see the reason why they are doing that. Same goes for eating and the same goes for self-injury. All of these things have a regulative effort behind them. The patient is trying to somehow reduce their anxiety about the feelings that they are having. And if you can help the patient see that, then you can encourage them to confront their feelings and you can help them regulate their anxiety in the session. Then they'll start learning that they don't need to pursue any form of drug or food or self-injury to achieve that same result. I hope you found this video useful. This was a response to a viewer on the channel. If you did, press the like button down below. Let me know what your thoughts are. The more you like the video, the more it pops up into people's screens with that YouTube algorithm. So please do like the video. If you're out there and you regularly watch my videos and you're not liking them, just know that there is actually a huge effect and you just going down there, pressing that like button. It actually does make a big difference. I appreciate it. Thank you so much. I'll see you again next time.